Hi everyone, welcome back to iMum's Women's Day Week. Today we have two very experienced doctors on this platform who will speak about a topic that you may not be aware of right now, but as new moms, probably if you are joining as a new mother, you may be aware of it. If you are pregnant, probably not as aware, but then Dr. Shachi will guide you and teach you everything about tongue and lip ties because it is so uh, an integral part of breastfeeding, and you might face issues because of that later. So I'll quickly move on to introducing our speaker and guest speaker for the day. Dr. Shachi is a pediatrician and a lactation consultant. She's been working as a lactation support person since 2010. So, a huge experience in guiding mothers towards breastfeeding. And she's also the executive team member and president of the Association of Lactation Professionals in India. So, welcome, Dr. Shachi, and we are really, really looking forward to this conversation with you. And our guest for the evening today, we have Dr. Preeti. She is a dentist, but her passion is mostly towards preventive dentistry. So she's been working extensively, doing community camps and trying to figure out ways to prevent the diseases before they happen. So she's also a guest lecturer at Malareddy Hospital, and she has ventured out into organic products under Lasange Venture. So, welcome, Dr. Preeti, and over to you.
Thank you, Anasia. So, hi, Dr. Sachi. Yes, so can we go into this interesting topic for the day? So, we have a lot of mothers who are here with us. And so, the topic for today is going to be about tongue and lip ties. So, as
Right.
new mothers, this is going to be an entirely new topic. Some might even not know that something like this even exists. So, can you quickly give us an introduction about what exactly you mean by tongue or a lip tie?
Right. So, Anusuya, can we have a slides show, please? Right. So, till the time Anusuya is setting up this,
Ma'am, you just need to go to your presentation
okay,
and
I
click
had
on.
already shared. Yeah, I had already
No,
shared. You
so when
said
you
you.
come back to the screen, na, it
Uh-huh.
changes. So, whatever screen you are viewing
Okay.
right now, yeah.
Right, right. Okay, got it, got it. I'll go to that. Okay. So today we are going to talk about tongue ties and lip ties, and not that we are expecting your babies to have these ties, not at all. And let's hope all your babies are breastfeeding well from day one. But because this is a very relevant topic in today's times, because anytime there is any challenge in breastfeeding, and a skin tissue band is seen under the lip or tongue, immediately a diagnosis of tongue tie is made. So, what we are going to talk about today is when is it a problem, when is it not a problem, and heaven forbid, if your baby has symptoms related to ties, how to go about it. And also, we are going to talk about what are the dilemmas in diagnosis, what are the confusions and controversies, right? So, to put it in a nutshell, tongue tie or lip tie is see, many people, many of us have small band of tissues under our upper lip or under our tongue, right? And this tissue is called a frenulum. So, whenever this band of tissue, which is connecting the underside of tongue with the base of the mouth, whenever it is tight, whenever it is short, whenever it is causing restriction to movement of the tongue, then it is labeled as a tongue tie. Similarly, the same tissue, if it is present under the tongue, if you're looking at these pictures, I've encircled these pictures, have a look. So, whenever they are present and they are thick, restrictive, or causing any challenge in movement, then these are called ties. So, important point here is this is not something that, if visible, it is a problem. It is a functional diagnosis. Functional means if it is causing challenge in breastfeeding, then we call them ties. Otherwise, we call them only frenulum. So it can affect mostly breastfeeding in the initial days, but as days pass, it can have challenges with other aspects as well. Yeah,
Yeah.
that's
Uh,
it, Preeti. Yeah.
That's great. So, going forward, as young mothers, the moment they deliver their child, they are in a state of, it's a completely new phase that the mother is going through. So, as
Mm-hmm.
such, breastfeeding itself is like, all of a sudden, it's a very new thing for us. So, we do
Right,
not know which is normal, which is abnormal.
right,
For
right.
us to
Yeah.
know that, okay, the child, we just think, okay, the child is just getting used to it. We do not know, for every single thing that we do, we have a
Mm-hmm.
doubt. Am I doing this right? Am I not doing this right? So
Right,
when
right.
do we know that actually my child is having some problem in breastfeeding, and when, whether it has really got this issue of a tongue tie? How do we actually diagnose it as a mother? What are the symptoms that we have to look for in the child?
Right. So before we go ahead with this discussion, few things first. If and when you are pregnant, it's a very good idea to invest some time in learning about breastfeeding, because like when you travel to some place, you don't just straight away pack your bags and go. You research it on TripAdvisor or maybe on yatra.com or animal Lonely Planet and all that. Likewise, when you're pregnant, it's a very good idea that you start reading about breastfeeding. Don't think that once the baby comes, I will automatically learn. If you can, attend a antenatal breastfeeding class, which is available at many places. These are COVID times, but before that, we had face-to-face classes, and at this moment also there are plenty of online options available. So do your research, see where you can get maximum benefit and attend classes. If due to any reason you cannot attend classes, at least become part of certain peer-to-peer support group, do something, read something, become part of some community where you can exchange information, learn more, right? So when we talk about what is normal when a baby is feeding, ideally, the moment a baby is born, the baby needs to be kept on mother's chest and breastfeeding needs to be initiated. And ideally, all mothers should have normal birth, but then ideal might not exist, or there might be changes at the last moment. So it's a very good idea to know that if your baby is kept immediately skin to skin with you after birth and the baby is being put on the breast, usually things go in a particular direction. So what is normal? Normal is for a baby to latch on from day one. Normal is for a mother to have adequate and sufficient milk supply from day one. Normal is for a mother to not feel any pain when the baby is feeding. Normal is for a baby to thrive on breastfeeding from day one, right? But there are certain signs and symptoms which can give us clues to consider ties. Now, like today's topic is ties, so I'm primarily talking about ties, but I tell you, even if your baby is not latching well on day one, you can have these signs. But if these signs persist, it's a very good idea to seek professional help. And please seek professional help from someone who is trained in supporting the breastfeeding diet and not someone who is maybe a pediatrician or a gynecologist or someone. So, a lactation profession should be able to help you with that. So, what are the signs that should tell you that you should go and see someone? Those signs are: baby is not able to latch. You're trying to position the baby on the breast. You're trying to breastfeed, but baby is not able to breastfeed. Baby is fussing lots at the breast. It takes hours to finally latch the baby on the breast. You feel pain when the baby is feeding, right? And then in the days that come, like these were the signs which you usually observe in the initial days, if you're not able to latch the baby on well. But if the baby is chronically not able to do that, he might cry, he or she might cry lots, he or she might uh, gain weight very slowly, there will be lots of spit ups, baby is very gassy. When you put the baby on the breast, baby many times gags like this as if he's feeling nauseous. Mothers can get nipple blisters, nipple injuries, or many times mothers come and they complain that the moment I put my baby on the breast, baby goes off to sleep. Important thing to remember is these signs can be there in many other situations also. So these signs do not necessarily mean that your baby has a tongue tie or an upper lip tie, even if these frenulums are present. But yes, if these signs are there, it's a very good idea to seek professional support, right? So mostly when babies have ties, what we see is even if the baby is latching well, mothers tell us that It takes a lot of time to latch the baby. I spend hours trying to latch my baby. Baby takes hours to finish a feed, and even after those hours, baby is dissatisfied. I feel pain during breastfeeding. My nipples are sore, my nipples are cut, there are injuries. Every time my baby feeds, I feel as if my baby is biting me. More often than not, mothers will come to me in the OPD and say, please check my baby's gums. See if my baby has teeth, because every time he feeds, I feel as if he's biting me. Right? And after you stop feeding, you notice that your nipple has come out very distorted, mutilated in shape. And then after some days of it, the milk supply starts going down, right? A mom can have repeated nipple injuries, repeated breast infections, blocked ducts, right? So just see these pictures. These are just an example. If your nipples look red, they have injuries, your area around the nipple looks red, these can be signs that baby is not latching well. And you need to take help. And where even after latching well, these signs are there, it can mean that baby can have a upper lip or a tongue restriction. Similarly, in babies. So again, if you have seen small babies, you might have seen a few babies whose lips appear to like have blisters, or whose lips appear like a cobblestone appearance, if you know what I mean, cobblestones, right? So these are also many times visual pointers towards that there is something going wrong with the latch. So one of the causes could be a tie, but many other causes can be there. And when baby cries, you often notice that baby is not able to lift his tongue. That can be a pointer. So there can be many signs which can be pointers, but for you, if you are having these issues, you are feeling that your baby is not able to latch on well, the feeding times are very long, very frequent. When baby latches onto the breast, baby makes this kind of clicking sounds, milk is leaking, baby is not able to make a good suction seal, baby gags very frequently, then many times there is a diagnosis made that, okay, this is colic. Now this drop is being given, that drop is being given. But the question is, why is the baby colicky? Why is the baby ingesting so much gas? Many times we get babies who are so gassy that mothers tell us that I feed for 5 minutes and I bop him for 5 minutes. Then again, I feed for 5 minutes. I again bop him for 5 minutes. So again, when these things are happening, it is always a good idea to touch base with someone who's trained in breastfeeding support, who's trained in how to assess a latch, who can help you with positioning your baby better so that you can understand what is going wrong. Likewise, most of the babies we see with ties are not gaining well, but then some small percentage of the times we get babies who are gaining weight well. But still, if mother is injured, if baby is stressed, irritable, cranky, these are the signs that point us towards that something is going wrong and it needs to be assessed. Feeding is a game where a dyad is at work, mother and baby. As long as both are not comfortable and doing good and pain free, it always needs to be assessed. Preeti, I hope I've
Yes.
not taken too much time. Yeah.
No, no, no. Exactly. I mean, for us, it might look very simple, but when it comes to a new mother, they are in a very, very panic state. The moment the child is not able to suck well, we have all these questions going. Is my
Right.
feed correct? Am I positioning right? Is something wrong? Am I getting enough feed? Am I eating enough? Am I not eating enough? Am I eating right? We have this whole list of questions which comes up to our mind, and each one, the grandmother, the parents, the uncle, the aunts, and everybody, each one will have their own ideas, and they confuse it even more. Like the doctor
Right.
says one thing, our relative says one thing, so what he said was very, very informative, doc. So
Right.
I think the very important point that you mentioned here was about taking a antenatal session on breastfeeding, which is so, so important. That was such an important point. 100% I agree with this. And so, but in whatever you mentioned, doc, other than having a tongue or a lip tie, what are the other reasons where the child might not be able to latch well? Can you give us a little more
Right.
information on latching?
Yes, yes, that's a very good question, Preeti. And what I would like to say here is that anytime a baby is having any kind of issue, tie or no tie, what is important is working with mother and baby in a way that mom and baby need to work on the basics first, right?
Hmm.
So if I am not able to position my baby well due to maybe I've had a cesarean, or maybe I have some other challenges, or maybe I just simply don't know how to go about it, and my baby is just suckling at my nipples. That will also cause more or less similar issues, because the baby is only using nipples. Baby might hold it with his gums. So if a baby is gumming your nipple, that can mean that maybe your position is not right, or the baby is not latched right. So one of the things can be we are not able to do it, or we don't know how to do it. Another issue can be that during the process of birth, maybe the baby has had some muscle strain or something which is not allowing the baby to open his mouth big and grab it well. Or another reason could be it's an instrumental delivery, some kind of injury happened, which happens, right? And then another reason could be that, say for example, mother got some drugs, mother got any kind of anesthesia or pain relief or something to induce the labor. That also can have an impact on release of mother's milk, what we call as letdown, as well as baby's ability to suckle, because there are many well-known drugs that diminish baby's reflexes to suckling. So breastfeeding is an entirely, totally, it's a game of a coordination between mother and baby. Now, suppose one of the team members, they lose certain reflexes, right? So I'm trying to latch my baby. I'm trying to do everything right. I've been told that baby needs to have a large mouthful. But due to any injury or trauma, or maybe my positioning, or maybe some oral issue, baby is not able to do that. Or maybe due to drug issue. So point is, whenever we have these challenges, it needs a holistic approach.
Exactly.
Baby mom needs to be assessed. A whole feeding session needs to be assessed. It's a very good thing if your hospital has some lactation support, even if it is just a counselor, even if it is just someone who has experience in helping moms and babies, so that they can guide you. And if your challenges persist, you can always seek more help. Yeah,
Yes, great.
yeah, Preeti.
Well said, well said. Great, ma'am. So now the mothers have this, I'm struggling with breastfeeding. So does my child have a tongue tie? Does my child have a lip tie? So
Right.
how do we do?
Right. So, see, the first stop, as we were discussing before, also the first stop should always be a skilled lactation support person. Like depending on which area you are, what is the availability of skilled lactation support is there in your area. It could be an experienced nurse. It could be your pediatrician, because some pediatricians, they are so knowledgeable that they learn because they see lots of mother and babies in newborn period, so they pick up those skills. It can be your gynecologist, it can be your peer support group, it can be someone in the WhatsApp group you're a part of, but it's a good idea to take professional support if that is available. Why? Because a skilled lactation support person is someone who should be able to help you with how you're latching your baby, how you're positioning your baby. Because many a times what happens is that even a small change, a small, what do you call it, a small correction can bring immense relief to you, can improve your latch like anything, right? A skilled lactation support person will help you understand if your baby is taking out milk from the breast well or not. So there is one thing that baby is latched and baby mother feels baby is suckling and it's hours. But if the baby is not withdrawing milk, baby is just using up his energy and not getting fulfilled. So baby will be hungry even if after 2 hours of breastfeeding. So a skilled lactation support person will help you in positioning, will help you in assessing if the latch is good. They can help you in assessing if your baby is taking out milk from your breast. If you already have nipple injuries, they'll help you in managing your nipple injuries, how to go about it, what to do about it. They will teach you hand expression, because many times we see mothers who have such severe nipple injuries that they are not even able to put their babies on the breast. So while you're working on your latch and everything, if you can in between hand express your breast milk and add to the baby, it might give you some relief, right? If the injuries are serious enough and you're not able to latch on. And then they will tell you ways to give that express milk to the baby, because as Preeti said, that all confusion comes and then we start formula and then bottles come into the picture. So if there is someone who can teach you how to give that express milk to the baby without using a bottle, that will prevent problems later in life, because once the baby starts bottles, again, more challenges start coming up. And most importantly, an actual skilled lactation professional is someone who has very clear idea about his or her scope of practice. So, okay, now I've worked with the latch, but I think there is still something wrong. So, let me refer this mom and baby to someone who can address the other issue that's happening. So, before we go ahead to who to refer and how to refer, let's talk a little bit about what is latch, because everyone talks about latch acha hai, latch, we need to do latch, we need to latch the baby, oh, correct the latch, this is not good. But actually, what is latch? So, latch in simple terms is the way your baby catches hold of your breast, right? So, if the baby is latched well, the best and biggest sign is it should not hurt. And if the baby is latched well, you have been taught about this and it is still paining, that means there is something wrong with either the oral cavity or the external body of the baby. So before we go ahead to latch, for a baby to latch at a large part of breast, baby needs to be in a position so that we are supporting baby's own reflexes, which are already there at the time of birth for latching. So what are the reflexes? The reflexes are that if a baby is held close to the mother in a way that baby is well supported with mother's body, be it in any position, and baby is aligned closer to mother's nipple, nose is aligned closer to mother's nipple, and we touch the upper lip, baby always moves towards the touch. So if we are touching the baby here and my nipple is here and baby is here, baby will always open his mouth big and will try to come towards the breast. So if you look at these pictures, see where the mothers have supported the baby. The whole body is supported as well as the base of the head is supported. No one is holding the actual head of the baby, right? More often than not, we see that when moms are trying to latch on the baby, they hold their head because they are worried that the head might fall out, head might get strained. So they hold the head and try. Now, if sitting here listening to this talk, you try to open your mouth big, and then you push your head forward. See what happens to your mouth. Your mouth will automatically go small. And if you'll try to keep your mouth open, you'll feel a lot of strain on your jaw, where the upper and lower jaw are meeting, the temporomandibular joint. Preeti must be knowing, but this jaw joint, right? So for a baby to come at the breast, they need to be like this. Now, if everything is fine and just the position is the problem, if you position the baby well, baby will latch on good. Right. So what is a good latch? A good latch is where baby has taken a large mouthful of mother's breast. Again, full areola, half areola, 1/3 areola. Please do not think about it. Areola is the darker area around your nipple. So a good latch is where baby has taken a large mouthful of mama's breast. If this is mama's breast, baby needs to grab a large mouthful in a way that more part from the lower side is into the baby's mouth, and mom's breast should go towards baby's palate. Right? So if things are right, if there are no ties, if baby has no muscle tensions, baby's body is relaxed, mama's body is relaxed, and they are sitting as they should, baby is able to latch on. But even if with support, with the lactation professional support, you're learning how to do it, if the baby is not able to latch on, then we need again to have a look at what else is the problem. We'll come to that a little later. First, how a mother knows that my baby has latched well. So we have already discussed it will be painless, right? Mother will feel a nice big grab as opposed to a bite or pinch or gums, right? And baby will suckle for some time, pause, and will resume suckling again, will not sleep at the breast immediately, right? Baby's urine output is going to increase with each day. So day 1, they usually pass 1 to 2 urine and 1 to 2 stools. More is good, but this much should happen if the baby is latching well at the breast. Day 2, they are 2 to 3 stools and 1 to 2 urines. So as baby grows, with each day, baby's urine output and stool output should increase. Mother should not have any pain. Baby can feed n number of times. So whenever the baby shows signs of hunger, mother can put the baby on the breast. Mother should put the baby on the breast, and she should be able to see this. So urine output should increase, stool output should increase. Babies initial days lose a little weight, roughly 5-7% of their birth weights, at times up to 10% also, and then they start gaining weight. And both mom and baby should be comfortable. So that is the bottom line: growth, outputs, and comfort. Right? So that is the definition that baby is feeding well at the breast. Right? But if the challenges persist, even after taking support, right, and you are trying to do, but you are not able to do it because the baby feels so tight or the baby is not able to open the mouth, it's a very good idea to ask your lactation professional now, where do we go? So based on the challenges you are having, suppose your baby has had some small injury during the process of birth, or kuch khich kiya, some strain happened, something happened. Your lactation professional might have a team of a chiropractor or an occupational therapist or a physiotherapist, and based on the need, they need to refer you to them because she's working with you on the latch, but side by side, muscle issues need to be dealt with. And a very simple way to understand it is, suppose I have strain on one side of my neck. Now I'm trying to eat. My movements will be different because my one part is strained. Now you sort this out. And I will be able to open my mouth, use my tongue, use my jaws without any strain. So if a baby is suckling and one part is strained, there is a very big chance that baby will transfer that strain to mother's breast, and which will cause pain. So depending on the type of issues, your lactation professional should be able to refer you to someone. Now, suboptimal positioning, you will keep on working with the lactation support person. So here the lactation support person is like the conductor of what do you call it, where lots of instruments are there, and symphony or something. And they will keep guiding you kiske paas jana hai, but they will still keep helping you, right? And if after sorting all this out, or in addition to sorting this all out, you're seeing a frenum also, they will send you to a frenotomy provider, which can be a pediatric dentist, which can be a pediatric surgeon, which can be a ENT surgeon, anyone in your area who has experience in checking and sorting out these styles. Those are called frenotomy providers. So Preeti, that was my, yeah.
Lovely, lovely, Dr. Sachi. So there's one more thing which comes up on my mind. When we're talking so much about latching and the right positioning of the child to the mother's chest, is there
Right.
anything that we have to look for? For example, when a mother has undergone a C-section, or for some other reason she's not able to maintain that sitting posture, or not able to handle the child for the first few
Mhm.
days,
Right.
in that case,
Right.
what would you recommend?
Right. That's a very good question, Preeti, and I'm glad you raised this point because see, uh, there is no way of knowing what kind of a labor you'll have. You might have a vaginal delivery, you might have a cesarean, but it is important to know that you can feed anyhow immediately after birth in the OT itself, if your hospital has that provision, or at least the moment you are shifted to the recovery room, which is something where you will be parked for 2, 3, 4 hours after your cesarean. So babies do not need moms to sit up and feed. There is absolutely no such thing
Okay.
like perfect position. So even if I'm lying down, my baby can feed on me. So again, pregnant moms, pregnant families, pregnant dad, look up the videos of breastfeeding immediately after cesarean. How, right? Only thing that your baby needs is, as we discussed, close to mother's body, baby's nose aligned with mother's nipple, and baby's base of head supported. So if I'm lying down, if you're able to see me, and imagine I'm lying down. If I have a baby by cesarean section, someone can help me by putting my baby close to me. So stitches are here on my tummy, but my baby can be held close to me on his side with the help of a pillow, and someone can support my baby and help him latch on. Or they can put my baby like this across my chest and help my baby latch on. So remember, we discussed that hand should be at the base of the head. So whenever the hand is at the base of the head, baby's chin goes in and nose never gets plugged. More often than not, there is this confusion. Naak dab jayega. If we'll feed lying down, the nose will get blocked. Baby will not be able to feed. So that is why when you see these things, when you learn these things, when you are pregnant, you are able to do these things after your delivery. Because once delivery happens, all confusion starts happening. Oh, what now? What now? What? I don't know. And someone says, "Oh, you don't have milk because you had cesarean," and actually you start believing that person because you're not able to latch on your baby, you're not able to see milk. So it's a very good idea to learn these things in pregnancy. Number one, to talk to your obstetrician about this. That is also very important. See, again, most of the families have no idea. They don't want to, not want to, they don't know how to do it. So after the baby is born, and in the hospital baby is crying, the families actually, they pressurize at times the nurses and doctors, give something, because they are seeing their baby crying and they have no clue what they can do about it. So if you know, and if you tell your doctor that I want to do it, right, maybe they'll be able to provide you with support. Or even if they are not, maybe they'll arrange for something. So there is no harm in asking. And there is no harm in learning, so that you don't need anyone's help. You can be your baby's own champion and say, no, my baby is not going to get formula, and I'm going to put my baby on the breast. But yes, side by side, remember how to do, you need to learn how to do things correctly, because you said no formula and you're not able to latch on the baby. Then you should know how to hand express and add that initial milk to the baby, because baby cannot be kept hungry after the baby is born. So you should always learn, you should always talk to your healthcare providers, and you should have a plan B. Suppose I'm not able to latch on, then what? How am I going to make sure that my baby is well fed? So maybe learn hand expression. That is also one of the things that is taught in antenatal classes.
Yeah,
So yeah,
for that lovely explanation that you gave, because I know as mothers, when you undergo a C-section, that you are always on a lying down position, not that you're able to sit straight.
yes,
And
yes,
we always have this thought, that you should never feed the baby when you're lying down. So that's
yeah,
going to go, in the reverse direction, and it's going to be an obstacle to the child. And immediately, what they start doing is they start giving the formula milk unless she's able to sit right. So, which is,
right,
as doctors, we know that it is so important that the first feed from the mother is so rich, is such a lovely feed for the child, which is so important for the child's immunity. So I think you
right.
had a explanation, and it was so mothers. All that we have to be really very careful about is to take a lactation course even before your delivery. That is one of the very important key points that you had given, doctor.
Yeah, even if they can read about it, there is lots of free information also available. And there are lots of peer support groups that are giving out information. So knowledge is power.
Yes, yes.
Yeah.
So as we were discussing, it's a complete teamwork. It's not just it's the obstetrician, the gynecologist, the lactation
Yeah.
specialist. And as a dentist, I would like to add something here. If you are confused as to check whether your child has a tongue tie or a lip tie, there's just a very simple exercise that we teach the mothers. We'll just ask them to hold the tongue of the newborn, try to mildly pull it out. If the child is able to pull the lips slightly, the tongue just outside your lips, it's most of the time there is not any problem. Or you can just run your fingers on the gums and check if there is any small teeth. Sometimes the child is born with new teeth, which might also cause a pain there. So it is,
Okay.
you can even check yourself by just running your fingers over the child's gums to check if there is any teeth. Sometimes that's also causing pain during lactation.
Right. So, very good point about the nuchal teeth, but I will just add one thing where you were saying how to check for tongue ties. See, this is something that is that's something that even at times pediatricians do not know how to assess. So, if you have doubt, please go and see someone who is trained in assessing that. So it is not mandatory that all lactation professions will know how to do it. It is not mandatory that all dentists know how to do it. So there is no all here. Someone who's trained should have a look.
Very
That's the bottom line of this discussion. Yeah?
Yeah, great, great, great. So I think you've already told us about who can help.
Right.
Yes, it's not
Yeah.
just a doctor, it's about a physiotherapist. It's a whole team who has to work there.
Yes.
Great
Yes.
team, great doctor. So
Right.
why? But there is still a lot of confusion and controversies regarding this topic. Because and now we are in the stage where we don't just believe in one. We go here, we go there, we take an opinion from one doctor, second, third, fourth, and each one says one, and we do not know exactly what is the right thing to do.
Right, right. Again, see, till few years back, Preeti, we were struggling with, oh, I think there is a tongue tie and no one is willing to listen to it. And everyone says, oh, it's nothing, and no one is ready to treat the baby. But off late, our challenge is that right, left, everyone is just cutting it, right?
Mm.
So excesses of both are bad. Not knowing about ties and telling the mother to keep feeding is wrong, and cutting without the need for having to cut is also wrong. So we need to find some equilibrium, and that is where all the confusion start happening. Who decides, right? So why is it so confusing? It is confusing for us also, for those people also who have been working for years in this. But yes, if you know certain things, it might help you. So why is it confusing? Because there are so many factors, as we have already been discussing for the last half an hour, which affect baby's latch, like how the baby was inside your uterus during pregnancy, right? What kind of birth baby had, what maternal drugs baby got, what was the post-birth breastfeeding support, right? Any of these can have an effect. And likewise, we have very few trained professionals, as I was saying. So if I'm not trained, I remember around 7, 8 years back when I had no clue about these things. It took one mom to come and ask me, please check if my baby has a tongue tie. And I said, sorry, I don't know how to do that. So then I went and I learned and I said, okay, that's also a thing. So trained professional, someone who has learned, not necessarily a certificate, someone who has actually skill to examine it, and there is no teamwork. So if there are teams, so I have checked everything. I, as a lactation professional, have checked the latch. I've checked the milk transfer. Maybe a chiropractor has checked if there are any tightness or injuries. A pediatric occupational therapist has checked if there are any specific areas where the baby needs work. Right, a frenotomy provider then comes into picture when we have checked all the things. So because we at the moment we don't have big teams in India. Yes, some at some places we have, but then most of the places do not have teams. And like we said, like there is a fable about an elephant and blind men. So everyone is having a look at different part of the elephant. Some feel it is a big pillar, some feel it is a fan, some feel it is a wall. So what we need is for all of us to compare our experiences and then work on the family and have a holistic approach. So most important thing is to understand that many conditions can cause similar symptoms, and as healthcare providers it is our duty, be it anywhere in the spectrum we are. So it is important that we look at the baby as breastfeeding as a whole continuum, not just the oral cavity. So if a baby is having feeding issue, everything needs to be checked. This is a very, very important quote from one of the people I follow. She is Michelle Emmanuel. She is a pediatric occupational therapist, and she has developed many things to help tongue-tied babies. And she says that oral assessments are incomplete and inconclusive without whole body assessment. And this is what we have been discussing throughout this talk. So if your baby has been examined only orally and other things are not being done, it's a good idea that needs to be done. So what needs to be done is baby needs to be examined holistically. And I'm sorry I missed it, but in your team, pediatrician also needs to be a very important part, because pediatrician is someone who's looking after your baby and who's worried if your baby is not gaining weight, who's worried if your baby is having lots of gassy symptoms, and who will be either help in your breastfeeding journey, or if he feels that the baby is not gaining weight and lots of gut bursts are happening, so then he's the person who will prescribe formula because he's worried that the baby is not gaining weight. So it's a very good idea to keep your pediatrician also in the loop. So holistic examination, teamwork, pre-procedure preparation, again a very important topic. It is not just that you discovered a tie and you go to a frenotomy provider and he should cut. Any frenotomy provider who knows about breastfeeding, who knows about ties, will always work in association with the lactation professional. Will never tell you, okay, get it cut and everything will be fine. Those who understand the concept, right? And you need a post-procedure support and management team. So who are those people? Obviously, you'll need to go back to the frenotomy provider, but your main work will again be with your lactation professional, who will teach you what exercises to do, even pre-procedure. Why? Because tongue is inside the mouth. Mouth is an area which heals very easily. So if you are snipping it, if you have to get it done and you are snipping it and you don't do anything to strengthen the tongue, which was not being used properly till now, it might get reattached, right? So why do we start pre-procedure preparation? So that baby realizes that, okay, even if they are putting their hands in my mouth, everything is fine. It is not scary. As opposed to you start doing it immediately after the procedure, then baby is in pain. Then the baby might not allow you. So all these things need to be kept into consideration before we go ahead. Yeah, Preeti?
True. Extremely right. So, and even a small thing that I think Dr. Sachi we should add here is, being mothers, when we're talking so much about frenotomy and everything, it is a little panicky for them. But I think frenotomy nowadays also is a very, very comparatively a simpler procedure. And now that we have lasers, it is just a day procedure.
Yes.
Within a few days. So I think as mothers, they should be panicking when we're talking so much about frenotomies and all that. So
Yeah.
can you just explain us that that it is not something a very extensive procedure, and that it is still nothing very serious?
See, maybe that is the reason why they have become the norm these days. So
Mm.
again, it is a very simple procedure. It hardly takes a few seconds and in the hands of a good provider. When I say good provider, it does not necessarily mean lots of qualifications and decades of experience. It means someone who is hands-on with the procedure. Even if they are using laser or they are using scissors, they have good expertise. They know how and what to do, right? So per se it is not a big thing, and in fact what we have read in the old literature is in old times the doulas or the dais, they used to keep big nails and they used to routinely swipe under baby's tongue. So we do not want our babies to go under the knife unnecessarily, but yes, if it all comes down to if phrenotony is mandatory, then it's not something that's scary. It's something that's a very small procedure. You go, you get it done, and you are coming back home, right?
True,
So
true, exactly. So I think this eases them a little now. And so, is it the next question that comes to anybody's mind? Okay, now my child has got this. What is the reason that this child has got it? Is it
okay.
hereditary or is there something else? Why actually? And is there any ways that we can prevent without my child having such tongue ties?
uh, at this juncture, we don't have much solid studies or information about it, but yes, some of the commonly postulated hypotheses are it is related to some epigenetic cause. Epigenetic is when there is a modification in your genes due to your diet, your supplements, your lifestyle, things like that. And then some of the postulations, yes, they are hereditary. So we normally see that there is always a history of a tie in the parent or a tie in a sibling, right?
Right.
And more importantly, why we are seeing it more now. It was there pehle bhi. Now we have better ways to diagnose it. In the last few years, there has been a increase in awareness about moms wanting to breastfeed feed their babies, and uh, based on my experience, what I feel is there are lots of factors which are affecting breastfeeding. So if I just have a frenulum, like even I have a frenulum, if I just have a frenulum and rest all is fine, I get I get put on my baby immediately after my birth. There is good lactation support. There are no other muscle injuries, traumas. I will be feeding well and no one will even look under my tongue because there are no issues. But now I have an added insult of I got sprained while have being delivered, or due to my mom's lifestyle, I was born in a way that I was positioned in a way like, sorry, I will frame it a little differently. Not, it is not something that as moms we do intentionally, but if you look at our lifestyles, even if we are working outside home, also most of the days we are sitting, we are driving lots, we are, so our lifestyle makes our statues go kind of round, which cause the baby to be in a position which is not as should be, right? And then many times there can be challenges like I have a uterine myoma, baby has a cord around neck. So these are the things which add on to the challenges which the baby might not have had if the baby just had the frenulum. So
Mhm.
again, to summarize it, epigenetics, genetics, and our lifestyles and the way births are changing. So lots of medicines are being used, births have become medicalized, our postures have changed. So I feel these are the reasons why we are seeing more of that.
100% agree. I think the one important thing that I would like to highlight here is the moment a new mother is there, anything that happens to the child, the guilt factor sets inside the mother. For
Yes, yeah,
every small thing, we feel, okay, am I responsible? Did I do something wrong that my child is suffering with this? Did I
right.
eat something wrong that my child is having a sneeze? Did I
Yeah,
eat wrong? Did I position myself? So we have a lot of questions, and there's so much of pressure from outside. So mothers, as you clearly explained, this is nothing. It has so many reasons and factors as to why the child has. And nowadays, it's so common that one in every like almost 10% of the child who are born have this feature, and which is not very scary or nothing for you to panic because she's given you so much of information. So, what is the solution? And would you like to give us on this
right.
one?
So basically, I'm just trying to tell you guys only one thing. As parents, it is very confusing. Please remember that anything that affects baby's suckling ability impacts the whole body. So imagine yourself trying to search for food and not getting food. What will happen to you? You will become overly apprehensive. Okay, I got food this time, maybe next time I'll not get. Or you're struggling lots to get food. So whole of your body system will change. Suppose I am being starved. So all my digestive system, my nervous system, everything goes haywire and it starts preparing itself in a way so that it can preserve my life. Likewise, if the baby has oral restrictions and they are causing feeding issues, the baby's nervous system gets overstimulated. So I find babies when they're coming, mothers say they are not sleeping. Even if they are feeding the whole day, they are still hungry. Baby is gaining weight, but the baby is in a panic state. So it causes effect on baby's posture and baby's uh, sleeping ability. So everything is interrelated. Oral restrictions are there, there will be impairment of other body functions. But we have heard that if there is an impairment of other body functions, that also affects baby's suckling ability. So again, coming back to the original thing that we are discussing, feeding is a whole body phenomena. It's not just mouth. And again, this picture is from Michelle, who I was talking to you about. So what needs to be done is, suppose I am a mother and my baby is having feeding challenges. First thing, I need to go to a skilled lactation support person, right? The lactation support person helps me with latch, with assessing milk transfer, with assessing if my baby is getting enough, what to do if my baby is not able to feed well from the breast, how to add that excess milk, and they also determine if there is something else that's not looking right. From there, they might refer you to someone. If they feel that everything else is right and it is just the frenulum, they might refer you to frenotomy provider. But in all probabilities, they're also going to refer you to someone who can check baby's muscles, who can check baby's body tone, who can check for other things, right? And those people are called body workers. Now, this body worker can be, depending on the need, can be a physiotherapist, occupational therapist, chiropractor, craniosacral therapists, and based on that, they see your baby. And all of them, the frenotomy provider, the body worker, the skilled lactation support person, they work in tandem. And what is decided is the timing of release. So now that concept is no more there, that the moment you see it, you cut it. You need to time it. Because if the baby has developed many compensatory mechanisms and you don't work on that and you just cut, your feeding challenges might worsen or might not settle, or the baby might develop reattachment. So these are important points that need to be assessed. And then the timing for frenotomy is assessed if it is needed. And pre-frenotomy preparation, where your lactation professional or your frenotomy provider, depending on who knows what, they teach you the pre-frenotomy things to do. So there are oral massages, there are tongue suckling exercises that starts as early as possible. And then they take a call on when to do the frenotomy. And immediately after post-frenotomy, the post-frenotomy protocol is started. During this whole time, you are in touch with your lactation support person. So this is how we go ahead. So my take-home messages for all this is, yes, ties exist. So if someone says no, tongue ties is nothing, that's not right. But then we always should start from the basics. Immediate skin to skin contact, working on the latch, working on position, working with whole body assessment and management, as in seeing someone who can identify these things for you, and then assessing the need for frenotomy to time the release, pre and post frenotomy support, continued body work, and a team approach where the family is also integral part of the team. So not just the healthcare providers, you as family, the mom, the dad, the extended family. So all together work on it, and we can help our babies and moms breastfeed better. So that's the take home message from all this that we are discussing today. Preeti?
Lovely, lovely. It was wonderful. So, and I would like to add a few points here. Like as a dentist, when in case sometimes the child might just go on with this unnoticed, and there might be a tight tongue even when the child grows older. So sometimes they notice it only in a very late stage. So that time
Yeah.
the parent comes, when there's a small thing that we can notice is a lot of gap in the lower front teeth. So when you see something abnormal, all that we would suggest is immediately go and look for a specialist in that particular area, and they would be able to give us a good guidance and all that.
Right.
I think
Right. Right. Very valid. Yeah.
true, true. So it was a
Right.
great topic, ma'am, and I think now we'll have to wait for the question answer sessions where I'm sure the new moms
Yes.
have a lot of questions for us.
So much to learn from you, Dr. Shachi and Dr. Preeti. I'm sure the mothers had a very, an insightful session in this one. So, there are a few queries since we discussed a lot on breastfeeding. We are getting a few
Right.
queries on breastfeeding.
Hmm.
Uh, so, one query is I want to ask about my breast milk. It is just very little, like 5 to 10 ml in the whole day. And my baby is premature. What should I do? I'm taking lactose and medicine.
Hmm.
So, what would your take on that be, Dr. Shachi?
Um, if your baby is preterm and your baby is already in NICU, it's again a very good idea to check on how you are expressing and how much you are expressing. So ideally, if a baby is not feeding directly at the breast, mom needs to express at least 8 to 10 times a day. Talk to your baby's healthcare providers and start going for kangaroo mother care sessions. If your baby is not on support, even if your baby is on oxygen support and fluids, ask your healthcare provider if they can start giving you baby for trying direct latch. Because if you say you're having only 10-15 ml milk, that means either you're not expressing frequently or you're not using the correct technique for expression. No one was able to guide you well for that. And yes, body to body contact between mother and baby can help in releasing more milk. So do all these things, talk to your doctor, and start expressing more frequently, and definitely your milk supply will go up. You can keep having medications that you're having, but till date, there is no study which says that only medicines can build up your milk supply. Unless until milk is being used and taken out from the breast, your milk supply will not build up. Yeah.
Absolutely, ma'am. It's like a factory inside. So the more the demand,
Yes.
the more is the supply. Agreed.
Yeah.
The next question is, how do I know if my baby is full with the breast milk? Like, how do I know if my baby is getting sufficient milk?
Right. So again, if you look back at what we discussed, see, babies uh, can feed n number of times in a day. If your baby is satisfied, your baby will relax after a feed, will not keep crying, whining, staying cranky, will have multiple urine and stool outputs in a day. So usually babies who are less than 6 weeks, they pass many urines and stools in a day, like 5, 10, 15, 20, n number, lots of urinations. And even babies who are bigger than 6 weeks, they generally pass 1 to 2 soft bowel movements in a day. So outputs, being satisfied after feed, and weight gain pattern. So your pediatrician would have given you a growth chart with weight on one axis and age on one axis. So you will notice that your baby is following his growth curve. Whatever curve he was there at birth, he will follow his growth curve. So growth is going on fine. Outputs are fine. Uske baad everything is okay. So even if a baby is feeding at 2 hour intervals, at 1.5 hour intervals, at 3 hours intervals, as long as outputs and growth and comfort are there, that's it.
Yes, thank you, ma'am. So, coming to another question here, since we have a lot of pregnant ladies, is there anything they can do to prepare their breasts and nipples for breastfeeding? Like that is coming in the coming weeks for them.
Right, right. See, again, this is a very relevant question because in the olden times, there was this guideline that you need to prepare your breasts for feeding, you need to prepare your nipples for feeding, but it's no more like it's something of the past. All you need to do is get your breasts examined by your obstetrician, not to check milk supply, not to check anything, just that in case you have nipples which are inverted. Inverted means nipples are going down inside the breast. And when you stimulate your breast, stimulate, I mean you have inverted nipples and you gently touch here and you gently try to stimulate your breast, and you're not able to see them outside or they are fixed inside. So it's a good idea to have a plan B. Suppose I did not have. See, again, if you have skilled lactation support, even with flat inverted nipples, they will guide you how to latch the baby on. but not every place has a lactation support person. So start reading about it, how to breastfeed with flat nipples, inverted nipples, because remember, we discussed that baby does not just need the nipple, baby needs a larger area, right? So learn how to latch on and also learn hand expression. Why? Because all said and done, suppose you were not able to latch on, right? So what will you give to your baby? So if you know how to hand express, you will be able to give that express milk to the baby. Number one. Number two, many of us get fluids when we are in labor or after cesarean, and that causes most of us to have flat nipples. That does not mean that we cannot feed, because pointed or projected nipples are not mandatory to breastfeed, because baby needs to grab the areola. So the only preparation that you need to have is reading a little about it, maybe attending a class, have a plan B, that if there is no lactation support there, I end up with a cesarean, I'm not able to feed the baby, how will I hand express and express my colostrum for the baby, give my colostrum to the baby? Because as we discussed, milk is good for the baby. But if the baby is not latching and milk continues pooling inside the mother's breast, that is a trouble for the mother in the later days. So if she learns how to hand express, or her husband learns, it's a good idea if she learns, her husband learns, and whosoever is going to be there with her in the initial days, they learn, so that they can express and add on and prevent engorgement and challenges later in life, in the second, third day, fourth day of baby's life. Yeah.
Amazing, ma'am. Okay, so here is a query from Preeti. She is a mother of a 10-week-old, and the baby had frenotomy a couple of days back. But baby, after baby started latching, he's gumming a lot, and the pain has increased for her. I'm also
Right.
seeing an osteopath, but it is not improving. Any suggestions for her?
Right, right. So, Preeti, do check with your lactation professional as well as your frenotomy providers if they have taught you ample suckling exercises, if they have taught you how to work with the tongue, if they have taught you how to massage babies' facial muscles, right? And side by side, many times it can take a few days for all things to settle in. So keep working with your osteopath, keep working with your lactation professional. Ask if they have not given you a post frenotomy exercise schedule, ask them how to go about it, because if the tongue has been tied for so long, normally this frenulum dissolves by 10 to 14 weeks of in utero life. So if it was there in utero and after 10 weeks also, the baby's tongue has become accustomed to staying in a suboptimal position. So maybe that is the reason why your baby is gumming, and suddenly now when it is cut, the tongue has no clue what to do. So we need to retrain the tongue in the correct movements. Tell your providers to teach you this, and it will get better.
That's very helpful, ma'am. So here I'm getting few queries. I'm at the end of 8th month, but my breast is not producing colostrum yet. So will it cause problem in the future?
Okay. So see, most of us start producing colostrum from the 18th, 20th, 16th week of life. So even if you're not seeing it getting released, don't worry. Why? I tell you. We have certain signs that tell us that our breast is getting ready to feed the baby. Those signs are the area around your nipple, it starts getting darker, right? You can have raised, like on the area around your nipple, you can start getting raised tubercles, small, right? Your breast size might increase a little. In some, it increases a lot. In some, it increases a little. But most of us feel that the already body fit clothes have become a little tighter. If suddenly something touches your breast, or like something presses into you, you feel a little tenderness. So these are all the signs that your body is gearing itself to breastfeed. Now, as for the question that you're not seeing colostrum, it is actually body's intention to prevent the colostrum from getting released. Why? Otherwise, it will get released and get wasted. So colostrum actually gets released once your placenta goes out of your body. So your baby is born, and then your placenta, cord and placenta go out. So that is the time when your body's hormones, they fall, your pregnancy hormones fall, and your breastfeeding hormones shoot up. So that is the time you are able to release colostrum. But yes, Many a times, few of us have seen a little colostrum release. That is also okay. If you're not seeing a colostrum release, that is also okay. Do not worry about it. But yes, see a few hand expression videos so that in case you're not able to latch on your baby well, you know how to hand express. So if you're in your 8 month, don't try hand expression on your breast because it might stimulate your uterus. But do learn it by seeing the videos, and you can practice doing it on your elbow. Consider this at your breast, and learn how to do it. Watch lots of videos. Yeah.
Amazing. Last question for the day, because we've almost crossed our time limit. If
Yeah.
baby is having a tongue tie, will he have difficulty in feeding from bottle as well? And are there any exercises which can prevent frenotomy?
Again, see, if a baby is having a tongue tie, or if a baby is having other issues, because all these can cause problem with movement of the tongue, right? So baby can have trouble suckling at the bottle or cannot have, because when baby is breastfeeding, baby uses actively his tongue. So tongue moves like this in a massage, in a wave kind of motion, and massages the breast, and like this. So it here is the palate, and tongue moves like this and withdraws the milk from the breast. But if the tongue is not moving properly, baby might be able to use a bottle and have difficulty at the breast. And also, there are situations where the tongue mobility is so severely compromised that even swallowing that milk, making a grab or a seal around the bottle is also difficult. So, to answer the question, yes, the baby can have choking episodes at the bottle, dribbling of milk at the bottle, gagging with the bottle can have. And when you ask what are the exercises that will prevent frenotomy, so before we discuss exercises, it is important to actually ascertain whether frenotomy is needed or not. Because if we settle the other issues, the muscles, baby's other issues, baby's sympathetic overstimulation, any cranial nerve injury, we settle all that, maybe we'll come to that frenotomy is not needed. But even when we settle these issues, if the challenges are persisting, then frenotomy is needed and needs to be done. Right? Exercises help in optimizing the tongue movement. But if after settling the other issues, frenotomy is needed, then no amount of exercises will help.
Absolutely, ma'am. Our users, they definitely had a very educative session, and they are feeling like it was much needed. They are constantly thanking you in the chat. Probably you can check it out later on the app. Thank you so much, Dr. Shachchee, Dr. Preeti, for doing this session with us. Now, I'll just quickly show the certificate that we had prepared for you, and we will email it to you for doing this with us today. Yeah.
Thank you, Dr. Preeti.
Thank you, Dr. Sachi.
Thank you, Anusuya. Yeah.
Thank you.
And thank you to all the
So,
moms to listening to us. Yeah.
yes, so this is for Dr. Shachchee. Thank you very, very much. And a lot of moms will require your help after they deliver.
Right.
So, yes, we will definitely keep in touch. And to all the users, if you are wondering where to find such experts, we will come up with a plan to make
Uh,
your session better. And Dr. Preeti,
Anusuya,
yes, ma'am.
there is an ALPI service directory wherein
Okay,
they can find, if they need lactation support, they can find lactation support people in their own cities. And
great.
also, different peer support groups have recommendations for lactation professionals in your own city. Yeah, that's what I
Amazing.
wanted to add.
Yes, amazing, ma'am. And Dr. Preeti, thank you for being such a wonderful host to our audience today. And we got to have a very interesting discussion because of you. So, thank you very much to both of you. And to all the viewers, we will see you in tomorrow's session, another interesting, relevant session for women. Till then, happy Women's Day, and keep celebrating the whole week because you deserve to celebrate.
Happy
Thank you.
Women's
Okay.
Day.
Bye.